Hello, welcome to CVS Health Live, Focus on Awareness. My name is Steve Edelman. I'm a physician at the University of California in San Diego and Veteran Affairs Medical Center, and I am the founder and director of a not-for-profit organization called Taking Control of Your Diabetes, a patient-focused organization. And with me today is Dr. Dan Knecht, VP of Strategy and Innovation at CVS Health. Dan, why don't you say a few things about yourself?
Absolutely, Steve. Thanks for having me. As you said, name is Daniel Knecht. I am a still practicing physician and I work at CVS Health. I have the privilege of working across the enterprise to develop and implement a strategy around diabetes to make sure the care we help coordinate and deliver to our customers and patients are individual focused and addressing unmet health needs of those individuals. So thanks for having me today.
Yeah, you're welcome. Well, most of our viewers, they think of a pharmacy where you go and you just pick up your prescriptions. But I think all of you viewers are going to learn a lot more what CVS is doing to improve patient care and awareness. We have Joy Pape, who is a very famous certified diabetes educator in New York City. Joy, tell us something about your background.
So my background is I was born into a family that has a lot of diabetes, both type 1, type 2, obesity, and I myself have prediabetes. I've been a diabetes educator for many years. I specialize in diabetes and in obesity. And so what's exciting to me today is that we're teaming up with CVS. I've been a diabetes educator a long time, and from day one, I realized that the pharmacist was very much a part of the healthcare team, the whole team. Who do you see more of the professional healthcare team? Would be the pharmacist than anybody else. So to see CVS be involved is very exciting and very real.
Yeah, we're going to hear a lot more about that too, and I personally have type 1 diabetes. I see a ton of folks with type 2 diabetes in my practice, and we're gonna learn about what CVS is doing, and I was quite impressed preparing for today's program as well. Well, I think the first topic we can talk about cost and access. I think taking care of yourself as someone living with diabetes can be costly. However, if you're a bean counter, and Dan knows as well, you may spend a little bit more on medications, but if you can control the condition, you save a lot more money down the road in terms of complications. So Dan, you might want to comment on the cost and access of medications, and everybody's had hassles getting their stuff from the pharmacy and their providers.
Yeah, absolutely. And from a cost perspective, what we're seeing across the country is that an individual with diabetes generally accounts for about double the amount of medical spend than somebody without diabetes. So, that's from a cost perspective, but from a sort of a patient perspective, I still work in the hospital as a hospitalist about once a month, and I see sort of firsthand the long-term complications associated with diabetes. So unfortunately, I oftentimes see patients needing amputations for diabetic foot ulcers that do not heal. As you both very well know, diabetes is the #1 driver of dialysis in the country. And also it's the leading cause of blindness. So you can see, so I see firsthand, and I'm sure you both see firsthand the implications on it from the human perspective as well as a cost perspective.
We don't want you to in our viewers too much, but diabetes is a treatable condition. Let me say one quick thing about statistics and the different type of diabetes to square everybody up, and then we'll get Joy's comment. The statistics on diabetes, I'm not going to go into all of them, but just to give you an idea, there's type 1 diabetes, the type that I got when I was a kid. Someone in Joy's family has that as well, and it takes up the minority of people with diabetes. It's an autoimmune condition. And the therapy is insulin, and now we have lots of technology like continuous glucose monitors. And about 110 people in the US are diagnosed with type 1 every day. Now, in contradistinction, type 2 used to be called adult onset diabetes. And if you can believe this, every day in America, 6,000 people are diagnosed with diabetes. And the cause of type 2 diabetes is quite complicated, completely different than type 1. Our toolbox has grown tremendously. And in terms of type 1 diabetes, what are the unmet needs? I mean, we're going to focus mostly on type 2 and pre-diabetes, but type 1 diabetes is really the trying to get your glucose under control without hypoglycemia and having a lot of fluctuations in the blood sugar. And we have issues with heart disease and weight as we get older. And Joy, what are some of the challenges most of the viewers on today's show have in terms of pre-diabetes and type 2 diabetes?
Well, I think that we've already opened that up to a point, and that would be the cost. First of all, I want to say access to care, access to education, which all comes together. So access to education, just understanding that you don't have to have the complications of type 2 diabetes. So that's not a given. A lot of people hear, I've got diabetes, they get afraid of all these things they've heard all their lives, and we teach them, it doesn't have to be like that, but you do need to understand. So access to education, people live far away from where education is even available. When you go to your physician, your endocrinologist, your nurse practitioner, your professional healthcare provider, they don't have the time to spend. But what happens is we go to our pharmacy and we pick up our medications, or we need information. And as Dan will tell us a little bit later, how easy it is to get somewhere or even to bring diabetes to the patient. Because people who have diabetes, either type 1, type 2, they're the ones that live with diabetes every day and need to understand how to manage their diabetes. So I would say access to care, treatment, and education.
Yeah, I would add to that, that's a whole segment, but certainly people with type 2 have weight problems, and their condition makes them more susceptible to weight gain. And we're going to talk about nutrition a little later on. And I think there's no sense of urgency because there's not a lot of symptoms when your blood sugar is high, when your cholesterol is through the roof, and when your blood pressure is high. And we know that those are some of the quote unquote metabolic conditions associated with type 2. So if you have type 2 diabetes out there, it's tough because you have a lot of conditions. You have to take a lot of medications to control your blood pressure, your cholesterol, your blood pressure. And it's costly and it's complicated and it can be scary, especially looking at some of these TV ads. Well, Dan, one thing I was quite interested in preparing for our show today was the data that you got from the morning consult data that you did. Maybe you can tell us about that information that you collected.
Sure, absolutely. So in honor of American Diabetes Month, we teamed up with Morning Consult to survey patients living with diabetes, as well as providers and caregivers who help these patients around sort of unmet needs and just to sort of better understand where these individuals are coming from. And three sort of key themes popped up. One, as Joy mentioned earlier, it's access to local evidence-based care. The second is understanding, managing, and predicting out-of-pocket costs associated with the therapies for diabetes. And the third is looking at additional services, whether it be nutrition or exercise, or perhaps even social services for these individuals. So those sort of themes popped out, and I would love to discuss a little bit more about that. But Steve, I think it might be helpful to just bring the group, sort of our audience up to speed. How do we find ourselves as a society in the middle of this diabetes epidemic?
Well, it's interesting because the government and private institutions have put a lot of effort into slowing down the rate of type 2 diabetes. And it turns out that the number of people coming down with pre-diabetes and type 2 diabetes, close to 25 million with diabetes now, and another 80 million with pre-diabetes, and we know a certain percent of those will convert to type 2 every year, the rates aren't slowing down. And despite all of the new medications we have, and I'm sure most of you have seen those on television, the new medications for type 2 diabetes, we see that trying to get folks their diabetes under control is still difficult. And if you look at national statistics, the number of people who have adequate diabetes control over the past decade has really not changed. So I think initiatives like the one CVS is doing and other initiatives to improve education, awareness, motivation, activating the patient into action will help improve diabetes at the community level. And I think, Joy, you might have some comments on that as well.
Yes, when you talk about that, with all these treatments we have, sometimes we forget the basics, which are things that we can learn through CVS. For example, some people are checking their glucose either by continuous glucose monitor or self-blood glucose monitoring, but they don't even know what their targets are. That's how much education we're lacking.
Mm-hmm.
Or, for example, when people take medications, they don't know really how do the medications work? When do they work? What are actually the effects? And what are the side effects to be aware of? And how do you treat those? Something else that really stands out to me of what has been said today is cost. A lot of times we think of cost of medications or cost of going to the pharmacy for medications or for a copay or insurance. But what about the other costs? This is what I think is so great about having something local. The cost of needing to take off work, to park, to sometimes take, as I said, take off work, not be at work. All of those are additional costs that add up for diabetes. And if we can learn more about preventing the complications, know how to manage our diabetes, or even have somewhere close that we don't have to take off a whole day of work to get access to care.
Dan, if you could, thank you, Joy. Dan, if you could briefly talk about the results of the morning consult, which is sort of what patients want, and also some of the data that came from the caregivers, because I think that will lead us into the next part of the discussion, which is what CVS is doing to address those issues.
Sure, absolutely. So there was one question that brought some very interesting insights, and that was around where patients and providers want to deliver care, lab services, tests, and about 90% of patients and almost 100% of providers said they would like a center or a place where all care, testing, and services can be provided, certainly in an evidence-based manner. And my observation, still being in the clinical space, and Steve would love your thoughts, is that this is such a complicated condition. There are so many moving parts. There are preventive care with an ophthalmologist, a podiatrist, there's nutritionist counseling, there's your primary care doc, sometimes an endocrinologist. It is just such a fragmented system that these our patients need to try to navigate.
Yeah, you're lucky. You just stay in the hospital and take care of people, and then you throw them out, and we take care of them. You're absolutely right, Dan. And Joy knows this quite well because she's part of the outpatient, as I am. When you have diabetes, it's not like having a thyroid issue, for example. It's complicated, and you're absolutely right. You have the primary care doctor, you have the endocrinologist, then you might have to see a cardiologist, a kidney doctor. And also, if you don't have access to a good diabetes educator that can talk to you about some of the lifestyle modification, that's a big part of it. And the thing is, most caregivers have 15 minutes to not only take in all the information, review what's told, and then get into what the issues are with diabetes. And that's why a lot of folks have a hard time getting under control. Their doctors, caregivers, nurse practitioners, they rush in, they rush out, and they're not doing it because they're going to go play golf later on. They're doing it because there are 3 patients behind and they got 3 patients to see before lunch. So it is a complicated condition, which brings to that this idea of centralized care. It's easier said than done, and I'll be anxious to hear a little bit more about the Health Hub model and how it's going to roll out. But I think it's definitely needed, and it can really be one of the determining factors that can help people get under control, but also get a little bit more motivated about their diabetes. Joy, any comments on that?
Well, just you say it can help them manage their diabetes, but also be more motivated. It's hard to be motivated when you don't see someone you can talk to for 3 months, for 6 months. But when it's at your local pharmacy, or even another way, if there's anything going to be happening online, which you'll tell us about, you can be more in touch and you can connect more and keep motivated. That's something I always ask people when I see them is, why do you want to manage your diabetes? Why do you want to lose some weight? If they're there for weight or diabetes, but a lot of times for weight, people say they don't want to get diabetes. So what's your motivation? And something else Steve had just mentioned, which you'll tell us more about nutrition. People are so confused today. There are so many messages about what to eat. And with type 1 diabetes, I always think first, insulin. People need to have insulin. But for the rest and for the majority, we look at healthy eating. Well, what is that? Our patients are so confused. Can you speak to what will be happening at CVS on this topic?
Sure. So a lot of great points both of you made. So first of all, roughly 70% of Americans live within 5 miles of a CVS. I actually remember growing up next to CVS, so I have a special spot in my heart for CVS, not just because they're my employer, but that's really a pretty exciting statistic. Think about the reach and access of individuals living in perhaps rural parts of the country or areas where they're just not providers or specialists that are seeing new patients. So that, I think, is a really exciting statistic. The other point that Joy made is the sort of the trusted pharmacist, the role of the pharmacist. I think the statistic was about a patient with a chronic condition sees a pharmacist about 20 times a year versus about 3 to 5 times a year of a physician. So that is such an important sort of connector or point of engagement with the healthcare system that we're really excited to unlock. So we have this, we're rolling out the concept of the Health Hub. So this is an enhanced CVS store that provides health products, services, engagement points with clinicians, but also with nutritionists, with diabetes educators. And actually, there's a really important role of digital here. I know having sort of a physical place where people can go is really important, but some individuals like to engage with the healthcare system through digital assets. So that's another enhancement there. In terms of the Health Hub, we're aiming to roll out 1,500 across the United States in the next few years. Very ambitious, but what we've been seeing is really great uptake and appetite by our customers and patients in where we've already piloted the Health Hub. And then just another point I think is important as a physician is that we will have electronic medical connectivity with providers to make sure any sort of interventions we provide or services we provide our patients at the Health Hubs is fed back to our provider partners. So that's the Health Hub in a nutshell. Really exciting core tenet of what we're trying to achieve at CVS Health.
Yeah. Now, so just to hear that again, you're going to set up 15 of these Health Hubs across the United States, and how will viewers find out where they are, and how could they access them?
Sure, absolutely. So it's going to be 1,500.
1,500.
Yep. So we work closely with our provider partners in the local communities we serve, and Aetna members will be receiving communications and education and additional services that they can come to the Health Hub for. But this is an open platform, and it's really just an offering to the entire communities we serve.
Yeah, that was going to be one of my questions. I mean, this reminds me of the phrase point of care, and that's basically refers to being able to get, for example, your hemoglobin A1C right at the time of your visit. But this point of care really seems to me refers to a lot of different things: education, access to the care, the information that you pick up goes to your caregiver. So they're not saying, gee, what are CVS folks, teaching you? So it's keeping everyone in the loop. And I think that's part of it. And as we mentioned before, there's so many different cogs on the wheel when you take care of someone with diabetes. It is a big initiative, and you're going to actually have CDEs and physicians at these 1,500 sites.
Yeah, absolutely. We'll have providers, so we'll have nurse practitioners and physician's assistants. We'll have diabetes educators, nutritionists, and then the objective here is to supplement the great work our provider partners are already doing in the community. I'd like to give you a pilot concept we're working on. It's around insulin titration. So, as you know, Steve, it's sort of time intensive, and it requires multiple touch points with the provider. So we feel that we would be able to help patients that either are about to start insulin or are on insulin but need some up titration and additional counseling. So what we hope to do are provide education around insulin, how to check blood glucose appropriately, up titrate insulin, and then ultimately what we want to do is just support the care that's already being provided by the physicians and the clinicians in the community.
Yeah, that's a big unmet need. Folks with type 2 to have their insulin titrated. And I think it's also important to realize that we have continuous glucose monitors. These are little devices for you folks that aren't familiar that measure your blood sugar every 5 minutes. And we know that this technology is coming to people with type 2 diabetes, and that's going to help with insulin titration as well. And then you look at all the injectables in people with type 2, the home glucose monitors. It's just nice to have support and be able to ask questions. And as a caregiver, Joy and I know that people come in back from a caregiver visit, and the caregiver thinks they're very clear in their instructions, but there's a lot of things going on in that visit, and the information that a patient takes home may not be the right information and may be completely different. It's just nice to get support. So I want to apply for a job at one of these places. Are they going to have any in San Diego? I wanted to just quickly turn, as we get sort of near the end, is to talk about big data. For those of you viewing today's show, big data refers to analytics, like you've heard of Google Analytics. Now that CVS is partnered with Aetna, all the big health care companies are able to collect very important data that can help them serve their customers better. So Dan, maybe you can talk about that a little bit and maybe explain it to the lay audience what big data is and what CVS is going to do.
Yeah, absolutely. So we're very lucky in that we are sitting on a vast repository of claims data, demographic data on our customers and members. And what the idea here is to mine these data insights in a HIPAA compliant way and certainly respecting privacy of our customers to identify, I'd say, interesting insights we can provide additional level of support or services. And so I would say that big data is necessary, but not sufficient to get us where we need to go. We need to have clinical insights to look at this data and understand what's actually happening sort of in real life. But also it's important to have an effector arm. And what I mean an effector arm is we need to have a way to support our customers and patients, whether it be through case managers, through our clinicians, through email, through mailers, and so sort of serve up actionable clinical insights for these people where we can help close gaps in care and help them achieve a healthier outcome.
Yeah, you mentioned HIPAA compliant data. That's important for the viewers to know. They're not taking information on you as an individual, they're taking large groups of people and looking at trends and patterns. And I did some research on administrative claim database for people with type 2 diabetes. And what we looked at was the adherence and persistence, the refill prescription rate. And I'm not going to go into the data in detail, but we saw that a lot of folks that are put on injectable medications like insulin, for example, had a very low rate of being on these medications after a year. And this is where support at the local pharmacy with insulin titration, explaining the fears and the concerns and the issues, and hooking them up with people like Joy, who have a wealth of experience talking to people about their diabetes and educating them how to use their insulin pens and how to titrate, very importantly, that can make a big difference. So I think the big data is really important to pick up trends and what people with diabetes need and other health conditions as well. Joy, did you have any comments on that at all? I don't want to.
Briefly, what comes to mind is you say that. Briefly,
Okay.
what comes to mind as you say that is start again.
Please.
So briefly, what comes to mind as you say that is just understanding and continuing on injectable medication. I got a call the other day that someone's been taking or thinking she was taking her injectable medication for the last 3 months. And she goes, Joy, I never took off the second top of the pen. So this is why my numbers haven't changed.
Yeah.
And
Well,
that's common.
Yeah, it's very common. I think this is one reason I started the not-for-profit organization, Taking Control of Your Diabetes, because people need education. They need motivation. They're these conferences around the country where people hang out with themselves, their brethren, other people with type 2, and they can realize that living with type 2 diabetes, once you control it, is really can make you live a longer and healthier life once you actually control the different issues that go along with that condition. Well, I'm going to say a few words in closing, and I want Dan to finish up today's show. But, I think the world is changing, and I love the fact that CVS is partnering with and other healthcare institutions to improve the care of people with type 2 diabetes by making local community centers where you can coordinate care. And I think that is just key. And type 2 diabetes is such an important condition. It's got all these side effects that Dan tried to scare us with in the beginning. But it's important for you folks to realize type 2 diabetes is a treatable condition. You take care of it, you'll live a longer and healthier life than if you were not diagnosed with type 2. And that is absolutely true. So with that, Dan, why don't you say a few words and we'll close out today's episode.
You got it. Well, first of all, I wanted to thank Joy and Stephen for this great conversation. I learned a lot. It was a lot of fun as well. As a physician, an employee, and a customer of CVS Health, I'm really excited to see this strategy unroll to make healthcare more accessible, affordable, and person-centric. So thank you again.
Okay. Thank you, everybody.